Ladies and gentlemen, I am going to tell you something about the deafness. It's a big problem, major disability regarded by WHO, that is World Health Organization. It is some listening problem. Deafness is present in every age group, children, adult, older age group. We have to do a lot. I did something. So in first time in Pakistan, I went as a representative from the E.N.T surgeons, both from the civil and army sector. They sent me to the General Ziaul, who was the president and chief martial administrator in Islamabad. They tell him something about this problem, deafness. Can we do something? There was nothing. There was no post of audiologist, no diagnostic center, no diagnosis of deafness problems. I went to Islamabad. I had a meeting on 8th May 1981 with President Ziaul Sahab, who was the chief martial administrator and the very strong person, and greeted me. And I told him the issue. He said that what I can do. I said that please do something, that we have got no diagnostic centers. He said okay. He issued the directive to the 4 governors, Quetta, Peshawar, Karachi, Lahore, and Federal Secretary Health, Lieutenant General C.K. that there should be diagnostic centers in Pakistan in all the provincial headquarters to start with, and 2 centers of excellence under the federal government, one at Islamabad and one at JPMC Karachi. It was the journey towards some problem to how to deal with the deafness. Deafness is only cured or can be tackled when it is diagnosed. Diagnosis is a way to lead to the success. However, first National E.N.T conference took place in Lahore. I requested President Ziaul Sahab that he should come from Islamabad and do the inauguration. He was very kind. He accepted my invitation, and then he came to Lahore directly from Islamabad to Lahore airport, and came from Lahore airport to straight away to Hilton Hotel, which is now called as Awari in Lahore. He was accompanied with Lieutenant General Ghulam Jilani Khan, you can see in the picture, and Federal Minister for Health, Dr. Nasiruddin Jogezi, and his press secretary is sitting on the back is Lieutenant Colonel Sadiq Saleh. He was his press secretary. I am standing on the dais and delivering the speech. It was a first breakthrough in this Pakistan at the highest level. The federal minister is there representing the whole country. Then Ziaul Sahab and Lieutenant General Jilani, he was representing the Punjab and he was representing Pakistan. That there should be something for E.N.T cause. E.N.T is a very important specialty, ear, nose and throat. However, I will be dealing with the deafness. It was the journey which started. However, now we have got the facilities to diagnose the deafness. Therefore, the post of E.N.T specialist, they were created on his directive at district level, and audiology post was also created. There was no audiologist. I was working in the MAYO hospital for a long time, and there was no post. Nobody knew the name of audiology or audiologist. However, in 82, 83, this system came. E.N.T Diagnostic Center, first established in MAYO Hospital, Lahore. I was working there. Then it was giving a lot of service to the various patients. In MAYO Hospital, E.N.T outdoor, I used to sit in the room number 51. There were hundreds of patients there coming from the various districts. The people used to come even from Quetta, from Bannu, from Miawali, from Sargoda, from Khanewal, up to Himyar Khan, up to even Sakhar. Because MAYO was the premier institute. MAYO was that hospital which came into existence in 1870. Oldest hospital, no hospital here. Because the British, when they came to Punjab, the first time they made the hospital and they made the King Edward Medical College also along with that. which was earlier made in 1860. I have been working in the Mayo Hospital in various capacities as a consultant, as a registrar, as a senior registrar, as an assistant associate professor, and then I used to deliver lecture in King Edward Medical College, University. You can see the photograph of me that I am moving with the principal King Edward Medical College, Professor H.N.S, in the Patiala block, which is the administration block. I used to go and deliver lecture in lecture theatre number 3 of this most prestigious institution in the north. First medical college was made by the British people there in Calcutta because they came there first. First office of DC was also established there. Before it was nothing. First medical college there, second in this whole north area. It was covering even Delhi. You will be believing that there was no medical college in New Delhi. There was no medical college in Lucknow or Bombay or say some Karachi. It was the place. I tell you very frankly, this King Edward Medical College is a topmost institution of the world. From here, I graduated. I read. I taught the student here also in the capacity of, assistant professor, as associate professor. I used to go and deliver lecture to the 4th year, final year students. They got benefit out of this. However, then their only main topics were 3. One was blindness, a very good institute there for the eyes. This one is deafness. Then deafness problem, I tell you, is so common that when I organized the 3rd SAARC E.N.T conference here in Lahore, again it was the first event from the SAARC countries. Professor Alauddin, he was the president of SAARC, he came from Dhaka University. He was the dean of, their medical institute. He brought about 40 E.N.T doctors from Bangladesh and gave very good, demonstration about the deafness problem. How to prevent, first step is how to fight against the deafness. Number 1, prevention by marriage counseling. Then number 2, if it has been established, then how we can improve, either by giving the hearing aid. This hearing aid is very useful still in this, most modern era. Surgery is having so many other complications, but this at least hearing aid is very easy. It's a simple and a fruitful, treatment. If the child is being fitted with hearing aid, when I organized the 3rd SAARC E.N.T conference, they said that it should be put to the child as early as possible. Don't wait 2 years, 1 year or 6 months. Now there are good gynae hospital where the child is born, day 1 they test the ear by audiology. By audiologist it is tested. Then if he needs, he is fitted with this hearing aid right in the first day. I am telling you, the earlier the better it is. Hearing aid fit, if you have fitted the hearing aid and then you do the speech therapy, child will be okay. Here people do the wait, then it is something, they are wasting the time of the child. Then I am telling you, there was a conference there in New York, World E.N.T conference, and Professor Jennifer, she is there. She is actually working in the house clinic, which is the best clinic of ear in the whole world in California, which caters the topmost people of the world. They go there, and it is to be known as the prime place of ear problems. I will tell you very frankly, she then gave me small disc also for the cochlear implant, that go and you are working something on the electronic media. On PTV, I used to give lecture on the Pakistan television. There was a health program, health forum. Then I, put that disc in that program and it was on air.
Transforms sounds into electrical signals, which stimulate the nerve fibers of the inner ear. This way, speech and sounds can be heard again. To understand the function of a cochlear implant, we will follow the path by any sound under normal conditions. Sound waves travel through the ear canal. And reach the cochlea via the middle ear. In the cochlea, the sound wave is transformed into electrical pulses, which travel down the nerves to the brain. Then the sound is processed. The sound is transmitted at a high speed. The cochlea plays an important role in the hearing process. The cochlea consists of 3 little channels filled with fluid. The incoming sound wave travels through the fluid and stimulates thousands of hairs on the top of the hair cells. The hair cells convert the mechanical energy into electrical impulses, which stimulate the nerve fibers. They form the acoustic nerve, which sends the message to the brain. The low sounds stimulate the top of the cochlea.
It has given some introduction. People should know. Awareness is very, very important. I have given, you see, this awareness through another conference which I organized as a 10th International E.N.T conference in PC Hotel. And chairman of the Senate, Wasim Sajjad, he came from Islamabad. He presided that. I am also sitting with him. You can see Professor P.W. Alberti, also he came from Canada, from the Toronto University. He also then gave the lecture on deafness. He was the world authority on the deafness problems. These conferences are basically meant for the mutual exchange, transfer of technology. No need to go abroad. The treatment in Pakistan, mashallah, now things are very good. I think so. Our students of King Edward Medical College, when they went to America, they made their place. In America, you can go to you see the 50 states almost in the USA. They are enjoying the best respect. However, deafness we can treat by 3 ways. Number 1, prevention. Distant marriages, counseling should be done before the marriages. Then by treatment, very simple, even with the small hearing aid. But then also cochlear implant surgery, which is difficult, which is expensive, and it is a new one. It will take time for Pakistan to get this facility at the grassroots level. Because the masses, they are not affording. That is very, very expensive procedure. Hearing aid is very cheap. Don't waste your time. Even you want to go for cochlear implant or some other surgical procedures. But hearing aid should be the beginning of that journey. Hearing aid is the cheap and very simple way which we can treat with the small child. Hearing aid to be given to the older age group. You can put there, hearing aid in the age of 65, 70, 75 or 80, and wherever it is indicated, just say as you get the spectacles, you can put in any age. When you feel that they are useful, put it on your eyes. In the same way, it is helping the person who is becoming deaf due to, that deafness in the old age is called as senile deafness. Very useful. In Turkey also, in Ankara, I went to the capital of Turkey and there was a conference there where they told that instead of medicine and surgery and all other, if you can afford easily hearing aid, it should be given as early as possible to the individual so that they can benefit. You can see delegates from Turkey who they were attending that conference. I am standing with them, and I think so. Deafness is that disability. We can do a lot. Thank you very much.